Hi, my name's Grace. My group will be discussing measles today and the importance of knowing signs and symptoms and interventions to help contain the disease. Measles is a highly contagious airborne disease that infected 3 to 4 million people annually before vaccines. Once vaccines were integrated into healthcare, measles was declared eliminated in the year 2000 from the US. A resurgence of this disease has occurred in recent years, primarily due to international travel and pockets of unimmunized people. Maryland is one of 23 states with cases of measles, 5 of which have been found in the Baltimore region and are contained.
Moving forward with the significance of the problem, because measles has not been an issue in the U.S. for many years, healthcare providers and facilities are not familiar with the signs and symptoms and may not be prepared for this outbreak. Containing the disease as fast as possible will help to minimize the economic effects on the patient and the hospital. Cases like these can cost up to $114,000 per case. Measles is a highly contagious airborne disease that can remain in the air for up to 2 hours after an infected person coughs or sneezes. Children under 5, adults over the age of 20, pregnant women, and those with a weakened immune system are at greater risk for significant complications, including preterm birth, death, and intellectual disability. There is a delayed response of about 1 to 2 weeks when someone has contracted measles and sees symptoms. However, an individual affected with the disease can spread it from 4 days before seeing symptoms through 4 days after the rash appears. It typically begins with a high fever, cough, runny nose, and red and watery eyes. 2 to 3 days after symptoms start, complex spots may appear, which are tiny white spots in the mouth. 3 to 5 days after exposure, a measles rash may begin, and it starts as small flat red spots on the face and hairline that spread down towards the rest of the body. Flat bumps can have red bumps on top of them. And since these signs and symptoms are very common for multiple diseases, it often gets mistaked, and that's why the infection spreads so fast.
Now that we've gone over the background and the significance, let's go over some recommendations to prevent the transmission of measles. The most effective way to prevent the transmission is to get vaccinated. Vaccines are offered in 2 doses and are given at least 28 days apart. The next way is to provide education to both staff and patients about the signs and symptoms of measles so that appropriate screening can take place. Encourage everyone to adhere to proper respiratory hygiene, cough etiquette, and hand hygiene. Measles is a highly infectious airborne disease. Patients who are suspected to have measles and those who are confirmed should be placed under airborne precautions immediately. Airborne precautions require that the patient is placed in an airborne infection isolation room and that airborne infection isolation room has 6 to 12 air changes per hour. The room door should remain closed at all times. Only personnel who are vaccinated and who have a custom-fit N95 respirator should be permitted to see the patient. Providers who have the custom N95 respirator must don the respirator prior to entering and cannot remove it until exiting the room. For visitation, only visitors who are required for the patient's well-being and for the patient's care should be permitted, and only those who are appropriately vaccinated. When transferring the patient to other units, provide a heads up to the new unit about the patient's status. Provide the patient with a mask and use a route that is least likely to expose other patients. Lastly, upon discharge, remember that the room must remain empty for at least 2 hours before entering with a new patient.